Hi everyone, I'm Hannah. Some of you might have met me yesterday. I'm a physio by background and I now work at Care City supporting a number of projects across North East London in health and care. So it's great to have so many students with us today and a fantastic panel as well from so many different backgrounds across health and social care. So I think we're ranging from a neurosurgeon to a tech whiz to a care manager. We've got a really nice range of people to talk to you about their careers today. Mez, do you think you can pull the slides up for me, please? And then
just 1 second.
No worries. And then what we'll do is I'll give all the panel a chance to introduce themselves properly so we can hear from everybody. And then we've got a number of questions that students put forward yesterday that I will present to the panel. And as we said yesterday, for those of you who weren't here, please do feel free to use the chat function if there's things that come to mind that you're really desperate to ask any of our fantastic panelists. So we've got Kwesi, Luigi, Chuck, Catherine, John, Julia and Chandu with us today. Can we move on to the first slide? And I'm going to ask, I can't remember who's first, but we'll see who comes up. Kwesi, you're first. Hopefully that's all right. So we thought we'd try and keep it short and sharp. So we've set all the speakers a challenge of a 2-minute timer to just introduce themselves, what your role is, and just tell us a little bit about yourself. And then once everybody's had the chance to do that, then we'll go into some questions amongst the panel. So are you ready to go?
I am ready, thank you.
Cool. All right, I'll let Mez start the timer.
Fantastic. So my name is Kwesi Eiffel. I'm the Assistant Director for Digital and Data at NHSX, which is part of NHS England. So essentially, I look after all of the digital and data programs that we are supporting the 42 integrated care systems with across all of England, which means hopefully better health and care outcomes for the whole population. I grew up in Leighton. So I'm an East Londoner, born and bred. I now live in North London, and I've been at NHS. I've been within the NHS about 15 years in various different roles, but the last 10 years in digital roles, where I get to work with Google, Amazon, Apple, Microsoft, and also, we try to make sure that we are using the right technology for people to help them to live healthier and longer lives. Oh, still got a minute. So essentially,
can I ask you, because I think some of our young people might not know what an ICS is.
Yeah, of course.
So would you be able to explain that?
Yeah, of course. So an integrated care system in your area. So for instance, in Newham, if I'm right, you have a hospital, Newham General. You have the Newham Council as well. And then you'll also have something called a clinical commissioning group. So that is essentially just a bunch of people that work with GPs. And what's happening with an integrated care system, they're all coming together. And that will include some other smaller organizations that help with things, some charities, so that everyone can really work together on be focused on improving the health and care of all of the residents in Newham. So they're coming together as one organisation on the 1st of April.
Amazing. Thank you so much, and perfectly kept time. Thank you, Kwesi. So who's next, please, Mez? Luigi, shall I hand over to you?
Good morning, everyone. It's nice to be here. My name is Luigi Maggiore. I'm the Register Manager at Three Sisters Care. We are a domiciliary care provider, meaning that we provide care to vulnerable people, elderly and people with disability, both physical and learning disabilities, in their own homes. So we provide support workers to go around and care workers to go around people's houses to provide different set of tasks for our clients, preparing meals, providing personal care. That means helping them to be washed, helping them to get changed if they have any continence needs. And my role is that of a register manager. So I manage the operation of Three Sisters Care, and basically I make sure that the care is delivered in a way that is safe, effective, and it responds basically to the needs of the customers. So getting feedback from support worker, getting back from service user, and hearing how we can improve the service, because I'm the person responsible to make sure that the service is run out in the best possible way. I come from Italy, and in 2010 I started working with learning disabilities, and I started as a volunteer, so it was pretty much a career progression, and it was a very enjoyable journey. I really enjoy working with people. I really enjoy meeting people with different needs and from different backgrounds, and I have to say it is a very, very rewarding career choice and job.
Thank you so much, Luigi. There was a bit of an echo on my... Is there an echo? Can you hear me all right?
Yeah.
Okay, that was just putting me off for a minute. That's great. Thanks so much, Luigi. And we are very blessed in East London that you've chosen to make a home here rather than in beautiful Italy. So I'm sure there must be something about the job that keeps you in our climate over the Italian climate. So thank you for that. That's really helpful. And I think I first came across Three Sisters Care a few years ago when I was reading about some things that you did with robotics and digital technology. So it might be nice to hear about that a bit later. That sounded quite interesting. Lovely. Shall we move on to the next slide, please, Mez? Chuck, it's over to you.
Yeah, good morning. Can you hear me?
Yep, loud and clear.
Yeah, my name is Chukwuemeka Michaels. I'm a student nurse. I have my first degree in health promotion and public health, and my master's in environmental health. All this while I've been working as a healthcare support worker. I could have, after all those degrees, I could have gone for something else, but I decided, because of the passion I have for the course, for this particular profession, and what I see my impact has made in the lives of people all over, but in the hospital and the community. It's something that is so amazing and something that, so related to me. And at the moment, I'm studying mental health nursing, PGD, and it's something that I want to carry on. And I encourage anyone to, come in and see what we can do to support NHS, especially in this unprecedented time rather. And it's all I can say at the moment, and encourage us to see it that way. Thank you very much.
Thanks so much, Chuck. And I think it's really interesting because yesterday we heard from a number of our health and care ambassadors, many of them who'd sort of changed career to move into health and care after starting off doing something else. So it's always nice hearing from someone who's training a bit of a later stage in their life and changing their career. So it'll be exciting to see where your mental health nursing career takes you. Thank you. So the next person I think was due to be Catherine Lund, but I think we have Joella here from her team instead. Is that right? I'm really sorry, Joella, we didn't get that. We didn't hear about that before, otherwise I would have put your photo and name up on the screen. Are you here?
I'm here. Just bear with me one moment. I'm trying to see if I can get myself onto the screen.
Oh, no worries.
Okay, right. Okay, great. So Good afternoon, well, not good afternoon, good morning, I'm ahead of time. So my name is Joellen Lucas. I'm the nurse consultant for infection prevention and control here at NELFT. Just to say, of course, that my journey in the NHS began way back in the early 90s, 1992. I've worked through a number of specialities within infection control, so effectively I am a nurse by background, but working in the NHS, you've got the opportunity to specialise in as many different aspects and roles within the NHS, and certainly that is true within the confines of nursing. I no longer undertake bedside nursing, so I'm not physically working on the wards, but I am supporting the organisation in terms of how we prevent and manage infection. So that's pretty much my role, and I'm sure that most of you would have heard about COVID-19 and infection prevention and control, and how important that role is. So I think nursing is it's an exciting job to have. You are given the opportunity to diversify into many different aspects within the NHS.
Lovely. Thank you so much, Joella, and thanks for joining us. And as you said, infection control is possibly an area that people may not have known much about before the pandemic, but it's certainly brought it to the forefront of all our minds. Thank you. Next slide, we have John. And I think apologies, because Chandu, you're here as well, and I think we may not have a slide for you, so we may have to work that out in a minute, but I know you're here.
Fine. No worries.
I'm really
No
sorry.
worries.
It doesn't mean we love you any less than everybody else. Apologies. John, should I hand over to you?
Thanks very much. I've just worked out how to push the unmute button, which is a good place to start. And now I get to play countdown like everyone else, which is great. So hello, my name's John. You heard a bit about me yesterday if you were here. I work at Queen's Hospital, Romford, and King George Hospital in Goodmayes. I'm a neurosurgeon here. Please don't get the idea that that's some sort of glamorous, clever job. It's a job that's every bit as valuable as all of the others that you've heard about today and will hear about throughout the 3 days. I went to medical school some time ago and worked through surgery, took some exams, worked through neurosurgery, took some more exams, and started working in this corner of the world in 2006. I have spent most of that time looking after the surgical conditions of people's brains and spines, and so have spent my time in wards, in clinics, in operating theatres, and in an office, because there's an awful lot of background work involving emails and writing papers and stuff like that involved in the job as well. More recently, I've developed a sort of second career in education, and that's what I mostly do now. I've worked for HEE, which is a part of the NHS that's responsible for training and education and delivering the workforce that the NHS so desperately needs. And now at the HRUT, I'm the Director of Medical Education, and I'm here to tell you that we really need you and you really need us. And I'm hoping that this week will persuade some of you to think about careers in health and social care and see the difference that you can make to the communities you live in by doing just that. And I think Carol Vorderman is about to tell me to stop.
That was brilliant. Well done. Thank you so much. And I think you've raised such an important point there, John, around how valuable it is having local people in local jobs, because we really understand the population we're serving, and it's really important that we can make sure that you brilliant young people are supported to work in our local health and care system if that's what you want to do. And also, I never thought that I would need a neurosurgeon, but I now have 2 neurosurgeons because I have developed a brain condition recently, and our NHS is incredible because we can turn up and we can have the care we need under brilliant people across the system. And I think it's just reminded me of that. You never know which point of the health and care system you're going to need as you go through your life. So I'm particularly grateful for neurosurgeons at the moment. Great. Shall we move on? I think we've got Julia next.
Yes, good morning. Hello.
Hi, Julia. Nice to meet you.
Okay, so I am a social work senior practitioner and currently work at East London Borough Tower Hamlets. So as a social work senior practitioner, I'm a qualified social worker, have been for 30 plus years, and senior just means that I partly manage staff, other social workers, and manage make sure with other people that the service that we're providing is a good one. So part of my part of my time is actually based at Royal London Hospital, where I am working with the hospital social work team, and the role there really is to support assess people when they're in hospital and look at the support they require when they leave hospital. So we work really closely with hospital colleagues and also have the opportunity to follow up people when they've left. And part of that role is around assessing, setting up care packages, and as I said, following people when they're discharged home. My background, to be honest, I wasn't planning to go into social care. Sounds a bit of a theme. I did a first degree. I was going to be a teacher, but actually did some voluntary work in an education setting that had some social workers, and that really sparked my interest. And I did at least 10 years of unqualified social work before actually taking my professional qualification. And I think, you know, that 10 years was particularly valuable for me because I did a lot of personal assistant work and residential work, and actually helped me sort of really consolidate my skills. I've obviously talked too long already, but
that's brilliant. Thank you. And social workers play such a crucial role across the health and care system. When I worked as a physio, I absolutely loved working with social workers in terms of helping our patients and service users get home and be as independent as possible. So I've worked with some brilliant social workers, so thank you. And the Royal London is one of the busiest hospitals in the country, I believe, so quite a challenging place to work in terms of the needs. Some of you students may have been there. I've certainly accessed the Royal London for my kids a few times. Okay, I think, Chandu, we do have a slide for you. So I think the team, yes, we don't know whether the time is going to work, but I'm really sorry we haven't got your photo.
No, that's okay.
Shall I hand over to you?
Yeah, thank you. So thank you, Hannah. So yes, I'm Chandu. I'm an A&E doctor, and I work at BHRUT, which is Barking, Havering and Redbridge University Hospitals NHS Trust. So like Mr. Bracknell, to be an A&E doctor, you need to have done a medical degree first. But unlike Mr. Bracknell, I haven't completed the number of years of training following that to specialize in a surgical field like he has. Instead, I'm working in A&E, where we're rather sort of generalists, essentially. We, you could say, master of no trades and jack of many, or jack of all trades, master of none, in the sense that we need to be able to deal with anything that comes through the door. So in one way, that's actually a very specific skill set in itself, that you need to know a bit about everything and you need to know how to prioritize accordingly. So for me, I did my medical school, graduated in 2016, then did 2 years afterwards in what we call the foundation years. And in those years, we rotate across multiple specialties and see and get a taste of everything in multiple different areas of medicine. And then after completing the second year, F2, we are then eligible to apply for specialties. And for a long time, I thought I wanted to do radiology. But after getting a taste of direct patient care during my foundation years, I realized that I probably wouldn't be as happy as I would be in A&E if I was sort of more behind the scenes as a diagnostic radiologist. So since then, I've been working on many projects for my trust outside of clinical work. So that includes a lot of digital transformation work, medical education, tying into outreach, helping kind of promote work experience of the trust, that kind of thing. And a lot of that started as voluntary roles. Essentially, I just wanted to make the most of my skill sets and give back to people in the sense that I'm grateful to be where I am. And I know that I wouldn't have got here if there weren't really altruistic individuals who helped me along the way. So I wanted to do that. It's another reason why I'm here as well, because I love to kind of help those who are still very much open-minded and keen to pursue a career but not quite know where they want to go exactly yet. And so any questions you have related to emergency care or working in North East London, feel free to hit me up.
Thank you so much. I think it's both days, yesterday and today, it's been super inspiring for certainly the team and hopefully the young people, hearing from people with from so many different backgrounds across health and social care, and their unifying theme throughout all of their stories and conversations is that people want to make a difference to the lives of others. And we really appreciate you all giving up your time to share your stories this morning with our young people. I just say to our students, if anything sort of popped into your mind while you've been listening to those various bios and stories and backgrounds, please do put it in the chat. There's no stupid questions. And also, what we tend to do, the longer you work in health and social care, the longer you forget what you didn't know before you joined. So if we're using any acronyms or any words you don't know what they mean, please do just put it in the chat, because it's not a silly question. We can easily dip into jargon, and we don't want to do that. I think we've got one question. Great, from Rani. So let's kick off with this question, and then I've got a list of other questions from yesterday. So if we start with, what would you say is the hardest part of your job? And then maybe I can add to that and say, how do you manage that within your working life? So maybe I'll go back to you, Kwesi, as you started first, and then if any of the other panelists want to jump in, maybe just put your hand up if you want to answer this question, and then I'll come to you if that works. Okay,
I think there are many sort of complicated things as part of my job. I mean, what's really good is that I'm not working by myself, so I not only have my own team, but I work with other people across the organisation in the NHSX, so that's really helpful, because you know, sometimes you may feel you have to have all the answers. That's not the case at all. It's really a problem shared, you know, really is a problem, you know, being able to deal with and being hard. I think one of the difficult things is when you get fancy companies like Apple and Google and Microsoft and say, well, we've got something brilliant for patients. We just need, you know, to invest in this and invest in that. You know, sometimes it can be tricky to know who to go with. Now, I am an Apple person myself, so I have to be very neutral in that. And that can be sometimes tricky, but that's what I do to help me, is that we always go through a very good and transparent process. So we look at all of the different people that are saying they can offer us the best tool. We see that it makes sure it has value for money, first of all, that there are clear benefits to the wonderful clinicians and are actually using the tools and actually interacting with the patients, that the benefits to citizens, people, or patients, as you can refer to them, is going to be the best we can get for that value. And then we would normally be able to make a decision based on that. But it is tricky, especially if something looks really pretty and it looks really nice, but it doesn't always bring the added benefits or be able to deal with the problem that you're trying to bring a tool in for. So that's one of the things I'd say is a difficult thing to do.
Great, thank you. That's really helpful, because sort of balancing in the public sector this sort of keenness to actually make the most of digital, but then also balancing that with needing to get it right, and that is super challenging. So I don't envy you that task, but thank you for taking that on for the whole of the health system. And I think that may be a surprise for some of the students in terms of the opportunities within the health sector around roles, you know, they might not have thought, oh, there's this opportunity to work with Microsoft and Apple or tech companies or whatever. So there are so many different roles, even if patient-facing work is not for you. Luigi, I'll hand over to you next.
Thank you, Rani, for asking the question, because I think it's really important to know what's the hardest part of the job. And for me, it's a very easy answer, is having to say, no, we can't do it. It is a very frustrating part of the job. It is really frustrating and gets you really worked up when you can't do something for a client. So I have several times support worker or other managers, they come to me and ask, can we do this for the client? Can we provide this kind of care? Can we help them with this? And it's really hard having to say no in certain occasions. And sometimes there is no way around it in terms of what the organization and what our company can provide to the customer. But the way we work around it is working in partnership. So there are several charities, several other organizations, the NHS itself. There are people out there, befrienders, buddies, unpaid volunteers who can actually provide that kind of support. So it is a way of going around the no answer, the having to say no to a request, is actually work in partnership with other organizations and trying to find a solution for the question that was asked, and maybe putting it back to somebody else to help the client, and then making sure you're accountable in following it up, because it's not about passing the bucket, it's about working in partnership, which is completely different.
That's really helpful. Thank you, Luigi. And the social care sector have played such an important role in helping us get through this ongoing COVID pandemic. I know the BBC keeps telling us we're past it, but for most of us on the call, it doesn't feel like that at all. So I think we're still working through many of the challenges of COVID. And like you said, Luigi, there's been some good things that have come out of the last 18 months, and certainly around working with charities, local organisations, local communities, and working collaboratively to deal with some of these health challenges has been one of the positives of COVID, but it has been very challenging. Does anyone else want to take a stab at Rani's question from the panel? Feel free to jump in or just put your hand up. Yeah, go ahead, John.
Oh, sorry.
Oh, John and then Julia, how about that? Oh, you're on mute. I did this yesterday.
Amateur hour again. I'm so sorry. I guess some of the difficulty that a lot of us face perhaps, but which I notice, is trying to work with limited resources in a way that perhaps doesn't affect the private sector, trying to protect our most junior and vulnerable learners from the huge pressure that we are often under on the front line. But the thing I wanted to highlight is keeping myself well, making enough space for me in order to continue to do my job in healthcare. And I raise that to reassure anyone who's listening that is possible. That one doesn't need to flog oneself to death to work in this sector.
Thank you. Julia.
Yes, sort of following on from Luigi and John's comments, I sort of understand those sort of pressures. I suppose the other area I was just thinking around was working with people obviously has fantastic benefits, and really great to see people achieving outcomes they might want, but sort of just recognising that, you know, there are some people who might find it difficult to engage with health or social care services, or be quite challenging and not being very responsive. And I think that can really test your your sense of what you're trying to achieve. But, you know, I suppose over the years, my view would be it's about using the support around you. Luigi mentioned partnership working, certainly how you get other people involved to try and share that problem, which could obviously put someone, at a vulnerable adult, at risk, but also using supervision and your support from your managers. And, you know, so it's really about sort of knowing things will come up that might sort of test you, but actually you can, there's training around dealing with some of that, and also, you know, having supervision and support around you to work through some of that.
Thank you, Julia. And I think both of you have both John and Julia have highlighted the point that a career in health or social care is rarely a one-man band. So I can't really think of any role where you are working alone. You know, most of the roles are around collaboration, working with people, learning from others, working in a team. So if you love those sorts of things, then you will find that in health and social care. And agreed, I think we have faced huge pressures over the last year, and some of you may have heard today there was some things on the news around some of the challenges for staff who've worked on the front line during COVID. And but it is possible to get a work-life balance. I do agree with that. I think it can be challenging, but it is possible to do that and to look after yourself and have a good career. Shall we think about, so one of the questions yesterday, unless anyone else wants to follow up on that, but one of the questions yesterday was just asking, what is the day in the life, what does a day in the life of your job look like? And maybe we should go to Chuck on that, because that might be quite interesting in terms of hearing about your current training, and then maybe Chandu. Does that sound all right? And then anyone else who wants to jump in, maybe Joella after that. It would be nice to hear from a nursing background as well.
All right, thank you so much. Where can I start? To be quite honest, it's been so wonderful as far as I'm concerned. In my, you know, having my training done, it's quite a different view, quite different entirely. You know, moving from as a support worker into, you know, a role as a prospective mental health nurse. The training has been amazing. And right now I'm in a close-up-in clinic, and most of the patients that I've met on the ward, they are the ones I'm seeing now coming in the community, and you can now see when they're unwell, being in the hospital, and now they're getting better, being in the community. So it's kind of it's helping me to actually being able to understand, you know, their mental well-being at different times, you know, and know when they're relapsing and when they are really doing very well, and know how much they're doing with their, you know, daily engaging with their daily activities and all that. So it's quite encouraging, and the staffs around have been very supportive, you know, engaging me in a lot of things that I didn't even know before, you know, moving from, you know, one road to another. And, you know, supporting and helping people that need our help, you know, is something I'm looking at myself. What if I find myself in, you know, in that position? What if a member of my family find him or herself in that position? We all are, it's just a kind of a revolving thing. Okay, we never know. So what I'm doing for someone, you know, I'm doing it for myself. I'm doing it for a member of my family, you know. So NHS is a sector that is involve all of us, you know, is entirely all of us, whether you're a medical doctor, you know, a consultant, a nurse, a support worker, but actually have to start from somewhere, you know, to actually progress. Irrespective of your profession, irrespective of anything that you think that you're doing, this particular sector it will open, blow your mind open, for you to see things differently. So my daily engagement, has been so wonderful, and I've seen clients, most importantly, seeing clients improve. It gave me happiness, seeing them coming back smiling and calling my name, saying thank you, seeing that brightness on their face, and it's something that gives me joy. So that's why.
That's so nice to hear, Chuck. And there's something about being part of that patient journey, isn't there? So not just having a snapshot, but seeing them from when they were very poorly to then now where they're back at home managing their condition. That must be so rewarding. And you're right, again, with mental health, we never know who of us are going to be affected by mental health conditions, and it can affect all of us very easily. So it's fantastic to have good staff in the mental health services ready to support us. Thank you. Chandu.
Thank you, Hannah. So likewise, I want to echo that patient snapshot aspect, because working in A&E, my day-to-day, essentially, when I'm on shift clinically, would be to come at when my shift starts. So that can be ranging from 7 o'clock, 8 o'clock in the morning, or perhaps 11 o'clock a.m. To basically do a 12-hour shift in our hospital, which can vary across hospitals how long the shift is, and then finish the day, having seen somewhere between 10 to 15 patients in total, and deciding, what they need, what sort of conditions they have, making an initial diagnosis, which may not be, the most detailed breakdown, but at least enough to understand initially what their problem is, and if there are any life-threatening concerns or any aspects which require immediate specialist intervention, to arrange that with our colleagues in the hospital. And to echo what Hannah said, no one works alone in healthcare, and especially ED, we rely so much on our colleagues who are specialists. We rely so much on our colleagues who are in the department as well. So other colleagues at the same level, senior colleagues for supervision and oversight. And again, the snapshot aspect is one of the most fulfilling things for me, because we might not be able to have the outcome we want every time. That's unfortunately one of the realities of working in emergency care. Sometimes there are things beyond our control, and no matter how hard we try, we don't get the outcome we want. But when we do try every time, and often, we do get results right in front of us. We have tangible, meaningful change in how a patient's feeling, at least, in terms of their suffering or in terms of their distress. Or perhaps in some great, outcomes, we actually end up diagnosing exactly what's wrong, treating them there and then, and seeing an improvement within a matter of hours or even minutes for certain conditions. And that is incredibly fulfilling. I don't think there's anything quite like it in terms of having, an impact on a patient directly, doing it as part of a team in ED, because again, you're never alone, and then having that team spirit really come through to have meaningful changes right there in front of you. So again, to reiterate, my kind of day-to-day would, if I'm on shift, which obviously isn't every day, because to make sure we have enough rest, we often work 2 or 3 or 4 shifts in a row, and then maybe have a couple of days break, to basically rest and recharge. But when we're working on shifts, we do have, long hours. We do have an incredibly physically demanding job. But again, the day-to-day is so rewarding, because we do get to work right on the front line. Yes, there are challenges. Yes, there are tough conversations. Yes, there are, some days when you feel like you've given it everything, and you don't really feel like, the luck of the draw has gone your way. Either it's just been a bad day of outcomes, or it's been a tough day in terms of how the situations have arisen and resolved. But overall, in the long-term sort of reflection, I do feel that it's one of the most rewarding things I've done with my life, and it's only been in the last couple of years where I've really felt that sense of, personal autonomy for dealing with patients myself. But then you're never alone again. So even though it's autonomous, even though it's independent in terms of making decisions, if we're uncertain, there's always someone to ask. If we need help, there's always someone willing to help. And of course, when it comes to more complex or sort of multifactorial conditions, there's always another colleague in a hospital of a specialty or of a different sort of previous experience who can give us a more comprehensive answer. And often I actually go back and, after I've seen a patient 2 or 3 weeks later, I look up the sort of clinic notes, or I look up the follow-up discharge summary from a ward, and I realize, like, look, this is what happened for this patient. And that informs my decision making, that makes me a better clinician for the next time someone with a similar presentation comes. So yeah, to summarize, my day-to-day is very much based on a job that sees anything that comes through the door A lot of it can be very stressful, but there's nothing quite as rewarding as it.
Great, thank you. Yeah, I can imagine no day is the same in A&E. It's all different. You never know what's going to hit you, so to speak. But that's really helpful. Thank you. Always learning, and I think that's a theme across so many of these roles. Isn't it? Always learning and reflecting and improving our practice. Joella, do you want to just tell us a little bit about a day in the life of infection control, perhaps?
Yes, certainly. The day in the life of infection prevention and control can be very unpredictable sometimes, especially with COVID, and we've been dealing with that for the last 19 months or so. So we've had to look at different ways of working. It can be at times very stressful working in infection control, particularly around COVID, and where the guidance has changed so much over the last 19 months, and having to react and respond to those changes very quickly. But it's not just about in COVID-19. There are other infections that we are involved with and manage and monitor, things like your sort of resistant organisms. Now we're heading into the winter, the flu season. We'll be dealing with influenza. We'll be dealing with all the other respiratory viruses. And of course, I work within the confines of the mental health sector. And so that in itself can be a challenging aspect because of the type and the category of patients that we have. And so isolation might not always be the best thing in their interest. We undertake very much a lot of audits in terms of the service because it's about risk assessment, isn't it? It's around patient safety. So we undertake lots of risk assessment in terms of the environment, in terms of how we manage our patients. At the moment, we're actually dealing with an outbreak, and we're dealing with an outbreak of COVID-19. And so we have all that unpredictable nature. So we may have scheduled work, but if something comes up a little bit more urgent, then that has to be the main priority and, of course, the main focus. So it can be very busy. We are advisors to the organisation, so we do look at making sure that we've got the right policies, the right infrastructure in place in order to prevent infection. So there's lots of training, lots of education programmes that we undertake within the confines of the IPC team. Being an advisor to the organisation, you get lots of emails, and you really have to learn to prioritise and to be able to sift through all of those. So I think it's, you learn to multitask very well, but you also learn a great deal about risk assessment and looking at processes and making sure that they're actually in place and that it benefits our patients, but also to some degree benefits our organisation as well.
Great, thanks, Joella. I think, oh, can you hear me? I just had an unstable internet. Sorry, I'll probably freeze in the most unflattering position because that always happens to me. My team find it really funny. What was I going to say? Yes, emails. I used to be very anxious if I never answered all my emails on the same day. Now I have learned that that is not possible, and you have to have some boundaries in terms of self-care and looking after yourself. I think infection control, it must be so fascinating, and like everyone else, so much learning. You know, if you think about COVID, none of us were talking about COVID being airborne. Well, some people were, but a lot of people didn't realise it was airborne very early in the pandemic. So sort of having to change rapidly as we learned more about how COVID was transmitted must have been super challenging in terms of having quite limited information and research on a new virus. So we've got a few questions. One question that came up yesterday, which I'm not going to ask you all, but I think there is interest in pay scales within the NHS. So I'm not going to ask everyone what they're paid, but I would just flag to the students that generally in healthcare, and maybe Luigi can tell me about the pay scale and how that works in social care. But in the NHS, for most staff, we have quite a pay scale called Agenda for Change, which applies across most roles within the NHS. Doctors have a slightly different scheme, but it's all quite standardized. So you can just Google online NHS pay scale, and it'll give you an idea of the different levels of pay across the NHS. Oh yeah, John's just said exactly what I said, thank you. But one of the things that came up yesterday was just around, there is potential within the NHS really to move through the pay scales through your career. So there is opportunity to increase your pay as you get more experience and move through or move into different roles. So yes, do have a look at that on Google. That will give you an idea. And same for doctors. And then I think there's like one other profession that's outside of Agenda for Change, but I can't think what it is at the moment. But most of that's available on Google. Luigi, do you want to talk us through what that looks like in social care? Because I'm afraid I'm not so familiar.
Surely.
With that. Thank you.
So in private organizations as well as in charity, it really depends on the structure of the organization. I will say that the entry point, so the work of a support worker, a care worker, or activity worker in the case of day center, there will be most likely the minimum wage. We do try to pay London living wage, which, you know, it is something that underneath which it will be definitely difficult to make a living on a limited amount of hours. And we have to consider also that some of our workers are part-time, so their life condition, because they are working moms or you know, they're students, so they have certain needs for flexibility. They are working a limited amount of hours. So it is part-time as well as full-time or 0-hour contract. So there are all different kinds of contracts, but at an entry point, I will say that the pay is the London living wage. Then as you move on through the ranks, likewise with the NHS, you do have pay increase. So you move along the range of 25,000 to 28,000 for a junior management position. Then you have the mid-management position, which are between 25 and 32,000 pounds per year. Then you get a senior management position, which are generally around 35 to 45,000 pounds per year. And then you get a CEO level or just more senior level with maybe bigger organization, and you can get over 40,000 pounds a year. But it is a matter of, as you were saying earlier, progression. So as I found for myself, I started as a volunteer, so it is a matter of actually getting your foot in the door, as they say, and then as you get along with gaining more experience, you move through the ranks and you move through what you want to be, you know, specialize yourself in. And it is very likely that if you prove your worth and if you enjoy working within care, it is very likely that you're going to make you know, a career out of it, and you're going to make job progression, because they are good people, are very, very sought after. So if you demonstrate commitment, if you demonstrate to have good work values, and if you demonstrate to have a good working ethics, it is almost certain that you will be able to be given opportunity within and outside the organization you work for.
Thanks so much, Luigi. That's very helpful. And I think just for social workers as well, Julia, I think there's a standard pay scale for social workers, isn't there? But social workers in the health system would be on the NHS pay bands. Is that right? Oh, you're just on mute.
Yes, that is correct. I mean, some social workers are employed by the NHS, but I think probably the majority are employed by the local authority. Although there's a recognised, so for qualified social workers, there is a sort of recognised pay scale, but actually different local authorities do pay different rates, and there's a difference in pay between sort of children's social worker and adults. In terms of unqualified social work roles or social care officer roles, are similar to what Luigi has said, starting perhaps at the minimum wage, and then but social workers, I would think, certainly in East London, qualified social workers are probably getting around 35 to 45,000 pounds. I mean, obviously working for the local authority does have some added advantages, obviously because you're you know, you're a permanent employer, and I know that's a bit of a challenge for the private sector, particularly dom care, isn't it, Luigi?
Great, thank you. And interesting that both Chandu and Luigi spoke about starting in sort of voluntary roles as well when they were thinking about their career, and just the value of doing that if you can. I know it's a lot harder while we're in this sort of COVID period, but if you can find opportunities to sort of volunteer in an area that you're interested in, it really does give you good insight into what that job looks like, and it's helpful on your CV as well, so it's worth exploring that. I was going to ask, because I know training as well, training and sort of routes into different careers has come up a lot in the questions. Just to give you the heads up, we'll finish in about 4 or 5 minutes, so everyone can take a break. But I think as this question's come up quite a lot, maybe we can just cover it quickly. So I'll just hand it over to whoever wants to answer. But I know most careers within the health service rely on, well, a lot of their professions rely on a degree route, but there are increasingly other ways into careers. Is there anyone on the panel who's taken a different route in, or who can talk about sort of non-degree routes into sort of roles around them or their role? Yes, Kwesi.
So for myself, after college, it was a situation I had that my mum was a single parent, so I had to try and find a role where I wanted to potentially develop a career, but also help her with obviously the cost of running a home for me and my younger siblings. So I entered into the NHS at a band 5 as a assistant in a department known in many hospitals as outpatient. So basically, you're not in a bed, but you're receiving care from excellent clinicians, like have we been speaking, Chuck and John. And then I essentially just built up experience. So when I started applying for different roles to progress my career, there was, if you had a degree or evidence of continuous training. So if I'd done small courses to help me gain knowledge, but also it's on the job experience, or sort of experience gained, which would have given me equivalent sort of credibility as would a degree. So that's what I've done essentially. Funny enough, now I'm doing a work-based MSc degree in digital health as part of the NHS Digital Academy, which is a great privilege to be on. But that was my route. So I basically went in at a sort of entry-level role, and then worked my way up throughout the years, gaining valuable experience, and even experience that I gained like 10 years ago, I still use today, like with working collaboratively with people. You're able to refine those when you enter an organization, and then it helps you for more responsible, for jobs with more responsibility as you go up the career ladder, as it were.
Thank you so much, and that's interesting to hear about different routes in. And certainly when I'm looking to employ staff at Care City, degrees are not a be all and an end all for me. Actually, it's around what skills does this person bring, and like you were saying, the sort of equivalent experience. So actually you can learn such a lot through on the job learning that you sometimes might miss if you've done a degree. So I'm quite interested in values and skills when I'm looking at employing people rather than formal qualifications. Although, as you said, there's lots of opportunities once you're in a career path to then take up some of these learning opportunities to do degree or postgraduate qualifications. John.
Just wanted to let folk know that there's an apprentice route coming to medicine. In probably by the end of 2023, it will be possible to join an organisation like the ones you've heard about here that employ doctors as a healthcare assistant or a role similar to that, and join an apprenticeship programme lasting 5 years to train in medicine. And I think that might be a game changer for a lot of people, and that's why I wanted to highlight it here.
That's amazing. I was going to say something about that, but I'd only heard rumours, so I didn't know if it was happening for sure. So that's brilliant. And there's something invaluable about that on-the-job learning that you just don't get in a classroom. Those sort of soft skills about learning how to interact with patients and with peers. And so that sounds really exciting, because it'd be a great opportunity for our local young people to walk into that route into medicine. So how exciting.